Okay.
We are rolling.
Okay. Good afternoon, everyone. I'm Debbie Nansen, the Project Director for the VCSQI Support and Alignment Network 2.0. We are a contracted organization by CMS to assist in the Transforming Clinical Practice Initiative. Today, we're going to talk about the transformation roadmap that our organization is using to help move all of our participating practices through the 5 phases of transformation. Ivan Berkel joined VCSQI as the Transformation Improvement Advisor in early September. He is a Lean Six Sigma Black Belt trained healthcare executive, experienced in health system and physician practice strategy operations and continuous improvement. He's worked in organizations and facilities ranging from 25 to 1,100 bed acute care health systems, academic and community, critical access, and physicians' practices. He came to us as the System Director of Performance Excellence with Catholic Health Initiatives. We are so fortunate to have Ivan as part of our team, and all of you as participating practices, I know are going to come to love and value the time and calls that you have with Ivan. So without further ado, I am going to turn it over to Ivan, who is already sharing his screen. Take it away.
All right, good afternoon, and thank you very much, Debbie, for that introduction. As Debbie said, my name is Ivan Berkel, and I joined VCSQI in September in the role of Transformation Improvement Advisor. I've put these slides together this afternoon to walk you through the transformation roadmap and discussion that I have with practices very early on in the process. This PowerPoint slide is about 23 slides, and please feel free to stop me along the way to ask any questions. My objectives in going through the roadmap with the practices is to help them understand what to expect throughout this process, what to expect from me as the Transformation Improvement Advisor, what to expect from VCSQI and this project, and what expectations to be able to give their practices or anyone else in the office, whether it's a provider or someone else in the office who's going to work with them on their team to help support this. Number 2, we want to help the practices understand what is going to be asked of them. Make sure that they're clear that they've committed to doing a quality project, and just making sure that they're clear on treating it as a project, going through the steps, and submitting the deliverables. And 3, we want to go over it with them to create a project-like structure and a project-like environment in which to complete this project and basically set the tone. When we start, we like to start by letting the practice representative know where they are. Lots of times on that first call, they feel as though they've missed something or they might be behind. So I like to let them know this is a very structured process. This is where you are. You've enrolled, you've done the baseline assessments, and now we're starting to get ready. But please understand, we're not done just because we've enrolled or perhaps submitted some data. There are actually 5 phases of transformation that I am going to guide you through, and that's my role. So again, we step back and make sure that they're clear on what the 5 phases of transformation are. They are to set aims, use data to drive care, make progress on those aims, achieve benchmark status, and then thrive as a business via pay-for-value approaches. So in the prep phase, there are mainly 6 things that we go over with them and want to touch base on. First, we go over the baseline assessment. We make sure that they understand the document, how it's laid out, what the information on it means, how to navigate it, and how to explain it to their providers. We go through the scores, we go through what is required of us. After that, we confirm that the primary contact is the right person to work on this project, and we ask about additional team members. I know that in many cases, these are small practices. The physician has enrolled, and they've given the practice manager or the quality person this project to take on. But as we go throughout this project, there's a lot more work to do. There are projects to do. There are cycles of change to implement. There are new processes to identify and put in place. So we advise them that if they are not thinking of this as a project for which they might need more team involvement, that might be something they want to consider and think about and bring back to talk about during our next meeting. If they are a part of a large practice where they do have a consistent weekly meeting, a team meeting, a quality team meeting, then we try and we identify when that takes place. One, because we like to know that there's a consistent time and place when the work is being done. And two, if we need to get in touch with the team to ask a question or follow up on something specific, we know when that's taking place. So that's a part of the conversation as well. After that, we review the steps of the roadmap just to make sure that they understand the big picture, understand it personally since they're going to guide their practice through it, and understand it to the extent that they feel comfortable explaining it to people. And we also review the logic model as well. After that, we start to use one of the quality improvement tools that we share with practices from the GE change acceleration process, and we'll talk more about that in later slides. The elevator speech. We do that because there's a lot of information being thrown at the practice at once. There's different acronyms, there's different people involved, and we want to help them craft a very short statement about what we're doing, why is it important, and what it is we're trying to achieve from this project or throughout this process. That makes it easier for them to understand and easier for them to explain to other people to get the commitment, support, engagement that they will need throughout this process. Also in the prep phase, we schedule a weekly meeting. This is one of the most important things with me. That's just to make sure that we have a consistent time and place to touch base each week to go over the different milestones that we're working on. It's a place where we will discuss the milestones, troubleshoot them, and I will guide you through ways to address them and answer any questions that come up. And last in the prep phase, we recommend that you watch the webinar that Dr. Rich did in September, explaining macro MIPS and APMs in further detail. We recommend that the practice leaders watch this. We recommend that this is a tool that is available if they would like to share it with their providers as well, if they have more questions. And those are the steps that we go through during the prep phase. I try to do this. I try to have this call a week after the assessment is done, just to keep the continuity going and just to keep the practice manager or the lead engaged and let them know that there is support on the way and support that will be there with them throughout this process. The elevator speech I mentioned, this is just the basic outline of it. Again, what are we doing? Why is this important? And what are our goals, or what does success look like? I do share an example that I drafted. I share this with practices. I'm not going to read through it. It's up on the screen. I'll give you just about 30 seconds to scan it. But in my experience working in the hospital settings and working in clinics, we start down so many pathways with respect to quality projects, with respect to throughput projects, with respect to other projects. And we often make the mistake of thinking that it's clear and it makes sense to everyone because we are using words like quality, process improvement, things that we believe everybody understands. But I think it's important to ask the practice, especially if it's a large practice that's going to involve a number of people. or if it's a practice that's working closely with the hospital throughout this project, that you step back, put on paper exactly what it is we're trying to do, what we're trying to get out of it, and why is it important. This elevator speech is helpful in creating the change that you need, or building the support that you need, or getting the consensus that you need to move through this project successfully. So I recommend that the practices take time to do this as well, and many of them do so. After that, we continue our calls and we start with phase one. In phase one, again, basically 6 things that we do or ask the practice to do. Number 1 is to choose up to the 6 measures. We know that those can be the clinical measures, they can be cost measures, they can be utilization. So we choose up to 6. We know that at first they may choose just 1 or 2 to start, and that's okay. But we have the discussion that the expectation is that we continue to look for more and continue to submit data throughout this process. In addition, we discuss the other TCPI clinical priorities, including opioid prescribing practices and patient and family engagement. We help to create the expectation that we will ask practices to contribute to discussion around these items, and that we do want to learn what they're doing, identify best practices, and if necessary, share those with others in our group and other groups as well. Third, we challenge the practices to identify a bold aim statement that they're going to commit to and work to improve on throughout this project. Fourth, we ask them to submit the baseline data for any of the measures that they have selected. Fifth, we recommend that they watch the webinar that we last presented on basic quality improvement principles and tools. And then last, in phase one, we ask them to take a look at the milestones that are incomplete in phase two and kind of think through them and set a target completion date. That's not a firm date. We just want them to set a date so we have a date that we are working toward. In my experience, if we tend to leave these milestones open-ended, that will tend to delay the project. So it's important for me in each phase to just set a loose target date for when we think we'll complete the next phase. Are there any questions so far?
I don't think so. What about you, Allie? No? Okay. So far, we're okay.
Good. All right. So once we do those main things for phase one, again, choose our measures, identify a bold aim statement, submit our data, we're ready to start phase two. Okay. In phase two, on our calls, we'll prioritize the milestones that are left and review the logic model. And that's something I will show you on the next slide. Week to week, we will evaluate each milestone on our calls. And as we discuss them, learn what issues you're having, learn what the background is, learn what data is available, we will start to identify the right performance improvement or quality improvement, PI or QI tool to address each of those milestones. The 3 main tools that I will introduce to the practice are standard work, the A3 or the OFI Action Plan, and OFI stands for Opportunity for Improvement, and PDSA. And when I work with practices, I will do a lot of training on these and explain them, and I will help you learn to use those tools. We'll also attempt—
And what is the PDSA?
That stands for Plan, Do, Study, Act. And I'll show you a very brief example in a few slides.
Okay.
And that is basically the cornerstone of all performance and continuous improvement work. I like to introduce it because it's a good tool for making small changes and continuous improvement. It's also consistent with the language that most other practices use when doing quality improvement work. So any of these collaborative environments that we're in, we're sharing with other practices, having that knowledge and understanding of PDSA is important. It's a very simple template that I will work with you through, and by the end of our work together, you will be very confident and capable using that tool. In addition, as we go through these phases and make small changes, we will document those improvements. And so we are challenging each practice that we work with to document 1 to 2 PDSAs per phase that we work through. That will, one, help you to document the small changes that you are making in your practice, document this TCPI project that we're doing and the work that was done, and it will also help you to become very proficient in those tools. And I've done lots of training on these tools in the past, and it will be something that you will pick up pretty quickly. And last, for phase 2, we submit the measures and aim data, and again, set phase 3 targets based on the number of milestones we have to complete. So I'm going to go into detail on a few of these things I talked about in phase 2. We talked about the logic model, and there's a lot of detail here that I don't want to be confusing at first. The main thing I want you to understand is that the items in green, yellow, and blue with the numbers all represent the different milestones. The milestones are broken down into 3 different categories of things we need to develop or put in place, things we need to implement, or things for which we need to demonstrate how we do something or how well we are doing something. So we'll go through each milestone on our calls and kind of talk about which category it goes into and how we need to address it. If we go back for a moment, in phase 1, we said we would review some of the QI and PI tools, and I mentioned I would introduce them as well. So let me step back and introduce 4 of them. And I go over this with the practices too, because one of the milestones, I think in phase 2, milestone number 19, asks practices, what QI methodology do you use? And so it's a part of my job to help the practices learn what these methodologies are and give them some tools that they can use, practice, and become proficient at as a part of this process. So in this journey, we will introduce the GE change acceleration process CAP, and we'll introduce the elevator speed. From the Lean Six Sigma school of thought, we will introduce the OFI Action Plan, or the A3. From the school of PDSA, or Plan, Do, Study, Act, we have a worksheet that will help the practices to implement new things and make small changes. And from the Lean Six Sigma school of thought, again, we're going to introduce this basic tool called standard work to help us document how things are done or how things should be done. So for example, this is the first tool I mentioned, PDSA. This is just a visual here on the left that shows what PDSA means. It's meant to be a continuous cycle, and a part of what we are challenging all our practices to do is just to get into this mindset of always improving, always getting better. Identify a target, a goal, work to improve it, either improve it and sustain it, or if we don't improve it, find a different way to tweak it to reach that goal, put that in place, and keep that cycle going. What we have created for the practices is a worksheet just to guide you through the discussion, the thought process before you put your plan on paper. So as we talk through the milestones, if this is the appropriate tool to use, this may be what I introduce and what we work through. Again, this is something that I will work through with you on the calls, but if you're also working with a team or a group in your practice, we ask that you take this back, share it with that group, share it with your doctors, and then bring it back to talk about with me on our weekly calls. This is the first tool. The second tool that we will use is the OFI Action Plan. And this again is for one of those things that we're being asked to develop something or create a plan. This is a template just to guide the discussion and the work that needs to be done. What is it that we we want to improve, how are we currently doing with this item, what information, or quantitative or qualitative, informs this, what are we going to do about it, and what's the follow-up. This again helps us to document this process. These documents are live. They often change as we add things to them, take things off. If this is the right tool for that particular milestone, it's something that I will work with you to populate and help you learn to use. The last one I'll introduce you is a basic tool called standard work. This comes into place when we want to document and keep our team on the same page for how our process is done, how it should be done, and why. This is a blank sheet that you can either do with paper and pencil or populate in Word. I have an example on the next slide that we use in the hospital for hand washing. We use this one for training as well, but it just shows, a picture or a screenshot of what needs to be done, identifies the step. Most importantly, identifies the key points and why. Lots of times these items are outlined or spoken, but the detail around how or why is missing, and that's often why things don't get done. And so this is one of the tools that we will help you learn to use as well. So just to take an example, and if we go back to the logic model, what's nice is that once we understand the milestone that we are looking at, what it's asking us to do in terms of develop, implement, or perform, it's easy to go back and say, okay, these are some of the tools that we could use for each of these things. Let's identify based on where we are, which is the right one, and I will help you to populate it. For example, I was working with a practice last week that was working on PAT milestone 15. It's a small practice, one provider. They see 1 to 2 patients per month. They didn't have a really firm process in place, but the office manager was able to tell me what she does and what's frustrating about it. They make 1 to 2 behavioral health referrals per month. They work with 2 providers, but the follow-up, the communication to the behavioral health providers is lacking, and both the verbal and the written communication from those 2 providers back to the primary care's office is lacking as well. So what I did was work with her to first talk through it, understand the process, and we decided to together to use standard work to document how that process should go. And so we used this tool. We basically documented the steps, the major step that happens, what are the important things that need to be done. Making this call to the behavioral health provider was an important step that was not happening, so we added that to this. Hearing back, getting that, the verbal and the written feedback from the behavioral health provider was not happening. So we went through this process, talked through this process, drafted this standard work that now we can take and share with other practices, because we're now starting to talk to those practices. We've agreed we need to do something. We have a document that we can use to, one, get the process on paper, use to share with other practices, use to share with new staff in those practices because there's high turnover, et cetera, et cetera. So this is one example of how we took an actual milestone that a practice was working on, identified the tool, worked together to complete the tool, and now we have something that we can start to work on and put this process in place. As we continue to work through this process, and its owner might be able to do a PDSA, a plan, do, study, act on, how did it go? After a few months, we'll have a number of patients who've gone through this process. We'll be able to quantify, did we do this? Did we do this? What were the results? So I hope that example briefly shows how we can take a milestone, find a tool, address it, and move the practice further along. And that's basically what we do for each of the incomplete milestones in phase 2 until, again, we're complete. We review the phase 3 criteria that are outstanding and then start to work on phase 3. And in phase 3, we do pretty much the same thing. We identify each milestone, we talk through it, talk through the issues that we're having, and start to work on them. One of the things that we do different, or that's additional in phase 3, because in phase 2, most practices will have had some practice doing standard work and creating it. In phase 3, we will start to challenge each practice to draft standard work for your opioid prescription practices. And that's not something we've done with any of our practices as yet, but that's something that we will introduce and work on with each practice as in phase 3 moving forward. But in phase 3, again, we'll evaluate each of the milestones on our calls. We will address them. Once we get into phase 3, the milestones start to challenge us to do more small tests of change, do more projects around the measures that we've chosen. And so we'll continue to use tools. We'll continue to do those small improvements and document them. Document 1 to 2 PDSAs until we complete the milestones in phase 3, and then again submit our data, review the milestones for phase 4, and continue the process through phase 4. And then for phase 5, again, we'll just review the outstanding milestones. We'll continue our calls as long as we need to, document at least one PDSA through phase 5, and then submit our data. And so when it's all combined on one sheet, the roadmap, the phases look like this. But as we broke them down and just put each phase on a slide, that basically explains how we go through this process and move the practices from that prep phase where they are through phase 5. And with that, that completes the slides. I hope that helps explain the process. I hope that helps to show how we address each of the milestones, show how we engage the practices, show how we build their QI, quality improvement and process improvement capability, and set them up for success in future quality and PI projects. And with that, I will take any questions or comments. I'd be interested to get your feedback.
I do have a question.
Oh, go ahead.
Who? Me? Jan? Okay. I have a question on the opioids. What is that one? I don't know. I don't understand what that is.
When I was discussing phase 3 and I mentioned that we would be drafting, is this one that came up?
Yes.
Okay, so one of the, this is a comprehensive project. If you recall, if we go back to what was in one of the earlier slides in the prep phase, there are a couple of other priorities that all practices are being asked to discuss, identify good practices, best practices, and kind of talk about throughout this TCPI journey. And those two topics are opioid prescribing practices and patient and family engagement. So in addition to the quality work and the cost saving work and that PI component of this work, we are also engaging practices to discuss best practices for opioid prescription and identify good practices, best practices for patient and family engagement that we share.
Yeah, this is Debbie. Those are additional high priorities for CMS and the TCPI project. I think we need to remember to start saying person and family engagement is the updated language for this. But also in an effort to help address the opioid crisis in the nation, there is a strong push and emphasis now for all of the contracted organizations to help their practices and prescribers revisit their current practices of opioid prescribing. So you'll actually be getting a survey, perhaps even tomorrow morning, where we're going to ask each of you for a little more information about this particular issue and how opioids are currently being prescribed by your prescribers. The other thing I was going to say, though, is that the logic model that Ivan shared for phase 2 came out of a work group of individuals from several contracted organizations like VCSQI. We worked together to try and come up with a visual and a plan that would help the practices understand how these different milestones fit into each phase. You know, sometimes one milestone is only in the developing score for phase 2. To get to phase 3 or to complete phase 3, you have to be in the implementing.
Yep.
So there's a current group working to develop a similar logic model for phase 3. I know we have a couple of practices that are approaching phase 3. So hopefully that will be a logic model available soon and will help visualize the same thing as that model that Ivan showed a few slides ago.
Okay.
Yeah.
Yeah, to me, this was really helpful to see that, oh, okay, developing is a score of 1.
Mm-hmm.
Implementing is a score of 2 for the milestone, and performing is a score of 3. So this same model will be created for phase 3 milestones. And some of those that perhaps are in developing here in phase 2 will be yellow, will be in implementing under phase 3.
Okay.
Any other questions or thoughts come to mind?
Not at this time, because I'm pretty confused, actually. I mean, I'm looking at all this stuff, and I'm thinking that, you know, I need to see more before I have any questions, because I really don't understand any of it, to be honest with you.
What part of it don't you understand?
Yeah.
Can you be a little more
Well,
specific?
I'm kind of getting that, you know, we're going to be going through phases to get to a goal.
Mm-hmm.
But I don't understand. First of all, I'm worried about how much work this is going to be, because, you know, I don't have 40 hours to put into this per week. So, you know, I'm kind of I want to understand what's going to be happening so that I can really determine whether this is going to be efficient enough for our office.
Well, so these are types of questions that I usually answer when we have that first call to sort of talk through how the process works. Most of the practices I work with, and we have our call each week is scheduled for an hour. Some take that long, some don't, and they spend an hour or so with their teams working on it throughout the week.
Okay, so what kind of teams are we going to have to get together here at this office, at family practice? What kind of teams are going to be asked of us?
To be honest, I wasn't prepared to have that discussion on this call, but it's something that I will set up, a call with you soon to start to go through what we talked about in prep phase and start to talk about what was on this slide. How is this going to work in your practice? Who is going to be involved with it? And kind of look at your assessment that came back and see, what does it say? What does it say we need to work on? So there's some questions that we can't answer until we take a look at that and we sit down and talk through it.
Okay.
So
And this assessment is going to be filled out by me?
The assessment is conducted as a phone interview. Eddie, who is also on our call, our assistant director, contacts the Quality Improvement Network, who covers your state, and we set up a 1-hour call at a time that's convenient to you or whoever else you want on the call. And usually Ivan, Eddie, or myself are also listening so that we hear your answers too and don't have to ask you to repeat, the fine nuances of how you've explained your score for each milestone. And undoubtedly, you've met some of these. I don't think we've had a practice yet that was a 0 on everything or even a 1 on everything. And the team issue, depending on the milestone you're working on, it might be different people. I mean, even in a small practice, there's a milestone that asks if you have an annual budget and if it's reviewed monthly and you're looking at the variance against what you thought was going to happen every month. So that might be someone from billing or a finance person. It might be one of the clinicians who is talking about patient volume. But depending on the milestone, the team might be different people. Now, if you're a small practice of 3, it might be everybody for everything. And that's where the pacing of what you address and how fast you move will come into play.
Okay.
But that again, so that depends on what came out of this assessment. And then we start to discuss about how it's going to work. So if you haven't done your assessment, I think you all enrolled on October 4th, is that correct? I'm going off the top of my head.
Yeah, somewhere around there, sure.
But you haven't done your baseline assessment yet, is that?
No.
Correct, okay. Then yes, as Debbie said, this is where you will kind of go through this process where they will evaluate your practice based on those criteria, and then we'll get the results, and then we'll start to work together and go through this process that we just talked through.
And who evaluates that?
Yeah, have we sent you that practice assessment tool? Who is it that was speaking?
I'm Janet Rodriguez.
Okay.
Yeah, no, I have not gotten a baseline assessment. Nothing to do with anything.
Yeah, Ivan or Eddie, we can send you your primary care, right?
Right.
Okay, so for you it's 27 milestones, not 22. But it's not a pass-fail or a right-wrong. It's evaluation might be a little threatening as a term. It really is just an assessment of where is the practice right now, and where can we help you make some change or transformation so that you're better prepared to get out of MIPS and into an alternative payment model, because then the practice is really based more on value, and that's where we all want practices to be, patients to be. We want to be part, I want to get my health care from a practice that considers value a high priority, not just, get me in, get me out. So that's what this is all about.
Okay. And who evaluates that and scores it?
You are scoring it, actually, through the interview process. And if your clinician leader cannot be on the call, this would be something he or she would need to look at ahead of time and help you know what the scores would be. But it's your best assessment of where the practice is. And then it's repeated every 6 months at least. It could be more often if we think you've moved faster.
Okay.
So and then together, you and us, the practice and us, not CMS, look at where your scores are and where there's an opportunity to say, yay, you're already at the milestone, or here's the place where you can do some additional transforming.
Okay.
Ivan, I hope it's okay that I jumped in there.
No, that's perfect. I really appreciate it. I had, one example that came to mind. There was a practice last Thursday that did an assessment in the afternoon, and they were doing very well, I thought. But one of the questions that came up was, do you have a process in place for surveying your patients? And, the individual, the office manager at the time, kind of talked through, well, we used to have these, cards and a box here, but no, we don't have a survey. And so the questioner asked her, well, you've mentioned a few things that you have. It's up to you. It sounds like you are a 2, but do you want to, grade yourself a 1 or a 2 or a 3? And so this individual, just kind of thinking about it, said, I want to grade ourselves a 1 because we can do better. Now, I called her today just to follow up and start to have this prep phase discussion with her. But she had already taken it upon herself to go into SurveyMonkey, develop the survey, and start to figure out a plan to get that survey out to patients. So I share that example to say it was something that, again, she graded herself on as a 1 when she thought about it, but she, in her head, knew that it's something that she wanted to do better on, improve on. And so she just kind of jumped ahead and started to work on the survey because she knew she wanted her score to increase. So I say that to say there's their criteria, they are their assessments, but they're things that you are going to evaluate. You're going to tell us how you think you are doing, and then, as Debbie said, we'll talk with you, support you to see how we can do better in those things. Again, based against the milestones. And once you go through the process of taking the assessment, hearing the milestones, hearing the questions, hearing what they are asking and what they are looking for you to be able to demonstrate or speak to, I think it'll start to make a lot more sense, Jan. But I think you ask good questions. And, those are things I'll keep in mind when I follow up, that I bring back for us to clarify and make sure that you feel comfortable with.
Okay, appreciate that.
A pleasure. Debbie or Jeff or Eddie or Jana, any questions that you would ask of what we presented? Any part of it that could be a bit more clear or specific?
I'm good right now. That's Janet speaking, and I'm good right now. But I will be looking for some things in my email. Is that correct?
Correct.
For the practice assessment tool.
For the practice assessment tool. Yeah.
Primary care one. Yep.
And okay, and then I also want to know if is there any way that these slides that you just presented, if those can be downloaded into an email so we can pull them off and reread them?
Oh, thank you for mentioning that. I forgot to say at the beginning that we were recording this, so you will not only get the slides, but you'll get a link to the recording that you can share with others if you want.
Oh, awesome. Thank you.
I'm not sure if we'll get it as fast as for tomorrow, but for sure early next week.
Okay.
All right. Well, with that, then I'm going to conclude. I would like to thank you all for joining and for listening to this overview of the TCPI journey, the roadmap, and I look forward to working with you in my role as Transformation Improvement Advisor.
Okay.